Welcome, friends. I am Dr. V.K. Chauhan, homeopathic physician. Revise with me homeopathic remedy Calcarea carbonica. This is part 7, and here we are dealing with clinical correlation. The text is taken up from Ellen's keynote, and this is a good study keeping in mind the standard of BHMS student and interns. So let us go ahead, sir. And what we are going to do is we are going to revise every PQR with corresponding clinical aspect. PQR 1 tells us about the constitution and temperament. So let us see. This is the somatotype of Calcarea Carb, and the characteristics of Calcarea Carb client is, in terms of physical attributes, you will find he is fat, fair, flabby, and he is having childhood tendency to obesity. Now, this obesity at times looks very normal to us and we don't give much significance to it, except that it is a constitutional feature of Calcarea Carb. But keeping in mind the current trends, we know that there is a kind of lifestyle which a child in his family setup is maintaining, and that is environmental contributing factors are there, which is very important to understand and curtail at appropriate time. Because if a child who is in young age, whenever you have to see that such kids who are obese, initially they look very good, they look chubby child, but there is a vicious circle of childhood obesity which may persist into the adulthood also. And the initial start takes place in home when children's, because they are not going outside, outdoor games are almost negligible nowadays, and they have indoor games and electronic games and cellular. So they hardly have any kind of a physical activity, and low physical activity and good diet contributes towards the obesity. As far as there is a mild obesity, it is a royal obesity, or you can say khate pite ghar ke hain, that is all right. But these kids, they find easy fatigue whenever they have to go for any kind of physical activity. They find they are tired and it becomes painful for them, and they don't exert that much as they had to exert in day-to-day life. This ultimately leads to further aggravation of obesity. Exercise is uncomfortable, child eats well, and then mild obesity turns into severe obese children, and severe obese children at the age of 14, 15, 16, by the time they reach their adulthood, you find that they are still maintaining their body weight. Now, this body weight makes you a kind of vulnerable, high risk person for certain diseases. So homeopathy believes that you are the agent of your own disease, and that agent is within you, and that agent, what we know, is miasm. You have some sort of tendencies which correspond to different miasms, and if these tendencies which are here in childhood, maybe the child was soric, but then ultimately he puts you into the bracket of psychotic child also, because obesity is a marker of psychotic trait, psychotic miasmatic trait rather, I should say. So these kids are vulnerable to asthmatic attack, musculoskeletal diseases, pains, depression, and in adult they have coronary artery disease, hypertension, diabetes, pulmonary diseases, and high mortality they are going to suffer from. So at this moment, if you have to address, you have to become very aggressive. You cannot be passive observant doctor. That constitution is there. You have given Calcarea Carb and patient will be all right. That is the old concept. It doesn't happen like that. Unless and until you become an interventionist, active interventionist, and that is the need of the time. So constitutional component is diathesis Calcarea Carb. Child has diathesis predisposition, indisposition to have or predisposition to have constitutional. Indisposition means to have obesity, and obesity that gives you ultimately intrinsic and extrinsic factors. They give rise to this particular problem. And as we have been talking about what are the risk factors for diabetes, hypertension, gallstones, osteoarthritis, hernia, and depression. So, looking at this child, you need to anticipate in terms of your intervention. And that intervention planning is secondary intervention because the primary stage is gone. When the vulnerability was there, a child is born to the parents who have obesity, their family history is having obesity, and by the time he grew up to the puberty and he developed obesity, now he is in the secondary phase of the disorder already. So maybe there is no symptoms, maybe cholesterol is within normal limits, maybe he is mobile, but then asymptomatic early secondary stage is reached. And we have to see what is the natural history of disease. So we can go for intervention, primary intervention, secondary intervention, and tertiary intervention. So here if you see the stages of the disease, the primary prevention is at the stage of susceptibility. When you have latent miasm, when you have latency, it is a dynamic state, and latent miasm expresses itself with certain traits. Those traits are there, but environmental factor ultimately uniting with intrinsic factor bring about certain changes, and stage of subclinical disease requires secondary preventive intervention because here the patient has got no symptoms because overt symptoms are lacking, but then you have the obesity. Pathological changes have started taking place. And thereafter, when he becomes adults by the age of 30-35, you will find that he develops hypertension, diabetes, osteoarthritic changes, muscular aches, pains, depression, gallstones. Then you find the full-blown picture of that particular disease. Late secondary stage is reached when you have symptoms also, and on investigation you will find positive biomarkers also. And tertiary stage is where that patient develops certain complications. So we have the child, Calcarea Carb child, in secondary stage, early secondary stage, where you have to go for intervention. So how to plan the intervention, that is most important issue. What we'll see, we are going to understand what is the natural history of chronic disease. So it can be divided into two phases, two distinct phases. One is the pre-pathogenic phase and second is the pathogenic phase or clinical phase. In pre-pathogenic phase, it is entirely dynamic. I can say from the miasmatic point, the miasm is at latent stage, but in organic stage, it is active miasm which is flared up, and it is going to present to you in secondary and tertiary manifestations. So let us see what happens in the latent phase. Truly latent phase, the disease is diagnosis. Disease is dynamic. An individual may be a young born child, newborn child, or child who is having 5, 6, 7, 8, 9 years of age, will not show any miasmatic trait except that he has family history of predominant miasm, mother and father. That history is very important, and here we require primordial prevention, means health promotion. All those habits which needs to be cultivated in this child, food habits, exercise, sleeping habits, so that he remains healthy for his life, because habits, they die hard, and this is the second nature of human being. Here at this moment, if you want to intervene, you can intervene from miasmatic point of view, and that is intercurrent miasmatic remedy can be prescribed at this phase, that to be also in very high potency and infrequently. Now immediately after this, you have the preclinical phase. Here you have all the triad: environment is there, agent is there, and host is there. So host and agent is within you. Environmental factor is your family, environment, food habits, and where you live in geographical condition. Here you will find the traits of the miasm are positive. Constitution is build up. Diathesis you can understand, and there is a high risk factor for specific diseases. Suppose he is obese, then specific diseases are going to be there, like hypertension and diabetes. Two foremost important diseases are there. And here we go for primary prevention, means specific protection from hypertension and diabetes. So this risk should be curtailed. Lifestyle should be the foremost thing to find in his environment what suits him and he needs to cultivate. An intercurrent constitutional remedy will be the best interaction, that intervention, and that too also in very high potency. At this moment, the disease is not developed, it is preclinical, but when secondary stage takes place, early secondary phase comes, here you have the positive, maybe lipids will be high if you go for biochemical examination. On sign symptoms, you will find symptoms are not there. Their patient is asymptomatic. And we know that this patient is going to have certain problems in future life, but at this moment he doesn't have. Even then he needs to be treated very aggressively. It means you pick up the patient at the asymptomatic stage and correct his lifestyle, reinforce the primary prevention, and you can give him, if at all there are few symptoms which are constitutional symptoms, you can prescribe on that basis a constitutional remedy. It should be in the high potency and infrequently. But if you cannot hold tight to that position, late secondary stage comes, and here we have the symptoms, full-blown symptoms. Whatever the symptoms are there with obesity, maybe frank diabetes is there, there is a frank stone, gallstone formation is there, and even in the late middle age you will find osteoarthritic changes might have taken place. That according to the symptomatic presentation, you need to treat them symptomatically, but same time you have to aggressively reinforce the primary and secondary risk prevention or lifestyle changes, and you can go for symptomatic treatment. Maybe at this stage you have lost that window. Early secondary phase is the window period where the disease is reversible, cure is possible. If we miss this window period, probably cure will never be possible even if you try very hard. In homeopathy, we say we can cure the disease, 100% we'll cure, but not once the patient comes in the late secondary stage. Possibility of complete cure is very, very obscure. However, the plain treatment planning includes symptomatic day-to-day medicine and intercurrent constitutional medicine or miasmatic medicine. But lifestyle management is the foremost crux of the management. And then if the disease still progresses, he comes into the terminal phase where already lot of complications have taken place, and terminal presentation always requires for disability limitation and rehabilitation. You cannot cure the disease, you cannot bring back the organic changes, but you have to make his life somewhat easier, and that is what is required. So here we'll go for palliative management, symptomatic treatment and mother tincture prescription. Lower organopathic remedies are to be given here at this stage. So let us see for obesity what we need to see. We need first to assess the obesity. Simple obesity, you have seen in Kent repertory that obesity is there, that is not enough. Drugs are not enough. You have to understand what is the real value of this obesity, and that is done by measurement, or you base your obesity on BMI. So here you will find underweight, and this is normal weight, and here it is slightly overweight person. We have BMI 25 to 29.9. If it is there, you have to start with conservative treatment. And if the obesity is 30 to 34.9, you have to be more aggressive. And it is more than for 35 and beyond 35, you can say beyond 40, you need to be very, very aggressive, because there are other comorbidities will be developing. So that is the risk assessment. According to the risk assessment, you will be aggressively treating your patient. So we'll plan a treatment plan, a kind of a treatment plan, how it is to be done. We'll see the category of what kind of intervention strategy we have, and BMI category. So first thing which in treatment what we do is, number one is diet and exercise and behavior, change of his lifestyle. That is the foremost thing. And then we have second option, whether we can just contain ourselves with diet and exercise and change in behavior pattern lifestyle, or we need to prescribe homeopathic medicine, or there is an option for allopathic medicine or option for surgery. Why these particular interventions are required, we have to be very much satisfied first before we opt for that. So if we have the obesity which is BMI 25 to 26, 26.9 probably, here we need diet and exercise is must, and homeopathic treatment is miasmatic intercurrent. Allopathic is not required, surgery is not required. We find from 27 to 29.9, we find that we can give the constitutional remedy, and diet and exercise will be aggressively followed by other medication is not required. If it is 30 to 34.9, probably you have to be more aggressive and you have to go for homeopathic, organopathic remedies. And you have a good option if you are not being able to help the patient. If he is not responding to your treatment, you should not continue. You have to be result oriented, and you have an option that you can take help from the mainstream medicine, allopathic medicine, and if you find it is essential at this moment, you will go ahead with that. But surgery, of course, is not the option at this moment. But if the obesity is more than 35 to 39.9 BMI category, you will find that homeopathic medicine can be given. Of course, diet and exercise has to be maintained more aggressively, but along with homeopathic, allopathic medicines also, if you see, a surgery can be kept in mind, and patient can be submitted to that bariatric surgery if there is a comorbidity. Maybe patient has become diabetic or hypertensive. That is the hallmark of this particular phase. And if you find the patient is beyond 40 BMI, then probably our medicine so far has been given is failed. Even the allopathic medicine has been failed. No doubt you want to continue it. It depends upon your ability to follow with this. But surgical intervention becomes very, very realistic kind of a approach if you want to treat and save the patient from further complications. Now we go to the PQR2 again, and we'll recap. Miasmatic constitutional type Calcarea Carb is SORA, and this is latent SORA, which has been given the symptoms: pale, weak, timid, tired easily. And what is the clinical insight we get into this? SORA is the fundamental cause according to the homeopathic miasmatic concept, and we need to read Chronic Disease published in 1828 by Dr. Honeyman. When the cause is known, it is known as primary or essential cause. When the cause is not known. In current medical literature, whenever you say the cause is not known, we understand that it is essential or idiopathic cause or primary cause. So how we understand in homeopathy, we understand if there is a primary cause or essential cause or idiopathic cause, we translate into fundamental cause, means that is SORA. We are talking about SORA in modern literature of medicine. And SORA, what we see in SORA, we recall the Organon aphorism 80, and in 80 aphorism there is a good description, a broad description of the miasm, all three miasms, and SORA is the only fundamental cause. This is the susceptibility. If it could not have been there, the secondary miasms, psychosis and syphilis, could not been able to hold on your system. So the SORA is the fundamental miasm, fundamental weakness, which is the precursor for the secondary miasms, psychosis and syphilis. So anyway, so that was just for the reference sake. PQR3, again, we've talked about obesity, and it is a kind of diathesis we are talking about. Causes of obesity we need to understand. Genetic factor is intrinsic, and physical inactivity is a lifestyle, and eating habits. Socioeconomic status is also important. Environmental factors are also important. Other important things like you have hypothyroidism, it is secondary cause of obesity. It is not the primary obesity. It is not the soric obesity. It is not the essential obesity. It is secondary obesity. Cushing's disease is also going to call, and then you have to have a different concept while treating this particular patient. So applied effects of obesity, we have to keep in mind. If you are looking at the patient who is obese, he is going to develop insulin resistance diabetes. He is going to develop cardiovascular diseases because of atherosclerosis, ischemic heart disease, hypertension, osteoarthritis, gallstones, even cancer, obstructive sleep apnea, psychosocial problems, infertility, PCOD, especially in females, and hypertension. Now, we see the PQR4, children with red face, flabby muscle, who sweat easily, takes cold easily. PQR5 tells us about large heads and abdomen. Fontanelles and sutures are open, bones are soft, develop slowly. Curvature of bones, PQR6 tells us, especially spine and long bones, extremities, crooked, deformed, irregularly developed. And PQR7 tells us about the head sweat profusely while sleeping, wetting the pillow around, profuse perspiration on the back of head, chest and upper part, difficulty and delayed dentition, PQR9 tells us, with open fontanelles, and 18 PQR tells us disease arising from defective assimilation and imperfect ossification. Difficulty in learning to walk. Children have no disposition to walk and will not try because weak extremities. So what all these things are telling us, they are talking about only one thing. Collectively, they are pointing towards the rickets. The Calcarea Carb child is a classical representation of rickets childhood. So friends, rickets, you will find something like this. These are the clinical features. Objectively, you can see the classic finding of rickets is widening at the wrist, rachetic rosary, bell-shaped chest, bone deformities of extremities, and there is a hypotonia in the muscles. So we have 10 important clinical features in rickets. So let us shortly see that, briefly see these. Delayed closure of fontanelles is one. Frontal bossing is there, boxy head we call it. Dental hypoplasia is there. Pectus, uh, 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 pectus carneatum we have. Then we have swelling in the wrist and the ankle joints. Wide sutures we have in the scalp region, in the skull, craniotabes, rachetic rosary, Harrison circle we have, bowing of legs we have. So these are the features which are very, very important. Clinically, rickets, it is a softening and weakening of bones in children, usually due to inadequate vitamin D. Lack of vitamin D results in reduced absorption of calcium and phosphorus, difficulty maintaining proper calcium and phosphorus levels. The bones can cause rickets. We go to PQR10. During either sickness or convalescence, great longing for eggs, craves indigestible things, aversion to meat. So these are the constitutional features we have. Strongest desire for egg is in Calcarea Carb. Mostly they like them soft boiled. Natrum phosphoricum prefers them fried. Aversion to meat is present also apart from Calcarea Carb, Calcarea sulf, Carb sulf, China, Graphitus, muriatic acid, Nux vomica, petroleum, pulsatilla, sepia, silicea, and sulfur. The desire and aversion are very important help for individualization, as they are the expression of the whole. PQR11 tells us about the acidity of digestive tract, sour eructation, sour vomiting, sour stool, sour odor of the whole body. That is how the Ellen has depicted the whole picture of Calcarea Carb patient. So acidity of the GIT ponds to GERD, gastroesophageal reflux disease, occurs when the stomach acid repeatedly flows back into the esophagus and mouth. GERD usually caused by the lifestyle and food they eat. Common symptom of an upset stomach and indigestion. It includes heartburn or acid reflux, nausea, bloating, belching, burning, bringing up bitter or foul tasting fluid in or food in the mouth, bad smelling sour breath, hiccup or coughing. PQR12 tells us about the girls who are fleshy, plethoric and grow too rapidly. This points to somatic component of young Calcarea female at puberty, and then PQR13 tells us about the menstruation in this girl. Too early, too profuse, too long lasting, with subsequent amenorrhea and chlorosis, with menses scanty or suppressed. This is in the child who is reached puberty. Initially, they have metorrhagia, precipitating to anemia, and later on they suffer from a scanty or suppressed menses. Severe anemia can always suppress the menses. These are the late features of amenorrhea, can be due to severe anemia and can be associated with obesity. And these girls, therefore, can be understood that these girls are prone to develop PCOD. PCOD happens due to the poor lifestyle, obesity, stress, and hormonal imbalance. And it is a metabolic disorder. And more severe form of PCOD can lead to an ovulation where the ovaries stop releasing the ovule. Next PQR is 14. Woman. It is a adult female woman. Menses too early, too profuse. Same as we have seen previously in the young girls. Feet habitually cold and damp, as if they had cold damp stockings, continually cold in the bed. So PQR 14 points to female of productive age with menorrhagia, and the cold extremities can be due to severe anemic state. The important cause of menorrhagia are dysfunctional uterine bleeding in 95% cases, endocrine dysfunctions like PCOS, hypo or hyperthyroidism. Hematological condition is ITP, von Willebrand's disease and leukemia, pelvic tumors, fibroid uterus, estrogen producing ovarian tumors. So these needs to be ruled out at this productive age. PQR 15 tells us about the least mental excitement causes profuse return of menstrual flow. So there is a biological relationship between stress and reproductive cycles. When the individual is stressed, the body releases the hormone cortisol, which is a stress hormone, and lower levels of cortisol will help us regulating the metabolism. They are beneficial, control blood glucose level. High levels of cortisol clinically are associated with, can serve as a catalyst for the fight or flight response, and it can reduce the inflammation and lower the blood pressure. When cortisol levels are too high, it may suppress the reproductive hormone. However, when hormone level are out of balance, some changes can occur with the menstrual cycle causing abnormal bleeding. PQR 16 tells us about fears she will lose her reason or that people will observe her mental confusion. So let us recap. Fear arises with the threat of harm, either physical, emotional, or psychological, real or imaginary. While traditionally considered a negative emotion, fear actually serves an important role in keeping us safe as it mobilizes us to cope with the potential danger. There is a condition which is known as dementophobia, a type of phobia that involves the fear of madness or insanity. People who have this fear are afraid they are going to be insane or losing touch with reality. The fear may be triggered by stress, especially when the family history of mental illness or periods of severe stress is present. PQR 17 tells us about the lung disease of tall, slender, rapidly growing youth. Upper third of the right lung, oftener the guide to the constitutional remedy than phosphorus. So these are the constitutional type: ectomorphic, mesomorphic, and endomorphic constitutional types we have. And this is the type which we are talking when we are talking about the phosphorus. Medical opinion from the days of Hippocrates to the present has associated tuberculosis with individuals having thin, long ectomorphic body frame. This habitus thysicus has been suggested by some writers as contributing to a lack of resistance among the individuals who develop tuberculosis. PQR 17, still we are talking about the pulmonary tuberculosis affecting the right upper lung in Calcarea Carb. So this is how we'll see the radiological finding, and these are the lungs, how the cavities are formed. Tuberculosis predominantly involves the apical and posterior segment of upper lobes and the superior segment of the lower lobes. Because of the relative higher oxygen tension and delayed lymphatic drainage in these areas, that is the anatomical fact and physiological fact, they are there which contribute towards the pulmonary tuberculosis. Young children who are soric, weak immunity, soric means they have weak immunity or they are susceptible, are more prone to catch airborne infection of pulmonary tuberculosis. Now, PQR 19 tells us about the rawness of the soles of feet from perspiration and then blisters and offensive foot sweat. Along with PQR 22 also talks about the sweat of single parts, head, scalp, they are wet, cold nape of neck, chest, axilla, sexual organs, hands, knees, feet, etc. So, sweaty hands and sweaty feet are very classical of Calcarea Carb. This kind of a sweating which can affect just one specific area or the whole body, known as hyperhidrosis or excessive sweating generally. The most of the time the people don't report it. Excessive sweating is called silent handicap. Hyperhidrosis, also known as polyhidrosis or pseudoria, is a condition characterized by excessive sweating. And that too also requires the staging. What are the stages of sweating? Because you have to see the value system has to be, intensity of the symptom has to be taken into consideration, and for that reason we'll see 19 and 22 rubrics, the quantification of hyperhidrosis. So these are the stages. The dry hand is the stage 1, normal hand stage 2, and stage 3 is humid hands, stage 4 is the wet hands, soaked and dripping hands is 5, and soaked and very dripping hands, they belong to the grade 6 of sweating. The causes of hyperhidrosis include the primary or essential, where they can be attributed to the stress, anxiety and nervousness. Secondary causes are spinal cord injury, alcohol abuse, diabetes, gout, hyperthyroidism, obesity, Parkinson's disease, pregnancy, Hodgkin's disease. Iatrogenic causes should not be forgotten. Antidepressant, anticholinergic, pilocarpine for glaucoma, and propranolol for high blood pressure. These are the common drugs used nowadays, and we should have this insight into the problem of the patient. PQR 20 tells us about longing of fresh air, which inspires benefits and strengthens. So let us see the Calcarea Carb is mentally apprehensive, fears loss of reason and misfortune, forgetful, confused, low-spirited. Calcarea Carb is also prone for pulmonary tuberculosis, which results in low oxygenation of the blood in closed spaces. And studies have shown that level of anxiety, stress and depression are reduced by being outdoors. Outside, fresh air can help help in high oxygen levels in the brain or in the blood, which increases serotonin secretion. Serotonin is neurotransmitter that alters mood. It brings about the happiness, Getting some fresh air is simple way to help improve mood. Fresh open air also rejuvenates patients who are suffering from pulmonary tuberculosis and previously they were treated in the Hilly Sanatorium. PQR 21 coldness of general or single parts head, stomach, abdomen, feet, legs. Aversion to cold open air goes right through her. Sensitive to cold damp air, great liability to take cold. So Calcarea carbonica is a generally chilly patient, appropriate for people who are sensitive to cold and have difficult keeping warm. The cold hand feet may cause poor blood flow and circulation, which may be caused by underlying medical conditions such as diabetes, obesity, blood clots, iron deficiency, or megaloblastic anemia. Such people generally feel tired and weak, and they may have the very weak immune system. PQR 23 tells us about the pit of stomach swollen like inverted saucer and painful to pressure. The most people experience abdominal swelling or bloating at some point of time due to the various causes. It feels as if though the abdomen has expanded and stretched, which can be very uncomfortable. Common causes include irritable bowel syndrome, lactose intolerance. Irritable bowel syndrome is a chronic gastrointestinal disorder that can cause symptoms such as bloating, stomach pain or discomfort, constipation or diarrhea, and lactose intolerance is a digestive disorder in which a person is unable to digest the sugar, lactose, which is present in milk. The symptom may include stomach, bloating, cramps, and pains, stomach rumbling, gas, and flatulence. PQR 24 tells us about the uremic or other diseases brought on by standing on cold, damp pavements or working while standing in cold water, molders, or workers in the cold clay. So, low temperature can increase the likelihood of getting sick. The body is not as effective at fighting a virus when cold air enters the nose and upper airways. So viruses such as the common cold, the flu, the COVID-19 often spread more readily in winters. When the individuals with familial cold autoinflammatory syndrome get cold, within an hour or so they develop fever, chills, joint pains, red eyes, achy muscles, and rash. In severe cases, patient develop kidney failure related to the disorder, or at times the patient may have the subclinical state of the kidney failure, and because of this particular stressful situation and there is superimposed infection, they become absolutely clinically overt cases. They are subclinical cases, but then exciting cause makes them overt cases. PQR 25 tells us feels better in every way when constipated. And PQR 26 tells us stool has to be removed mechanically. So Calcarea Carb has a flabby muscle and it applies to not only voluntary but also involuntary muscles which are present specifically in GIT, circular muscles. Therefore, intestinal peristalsis is slow and sluggish. The abdomen appears to be bloated. On the other hand, they may have craving for indigestible food articles such as coal, chalk. They dislike milk or meat. When the stool gets impacted, it needs to be removed mechanically. However, people who need this remedy often feel much stable when they are constipated. They experience discomfort and fatigue when the bowels have moved. Large stools can be hard at first and then sticky and then liquid. PQR25 feels better everywhere when constipated. We look like this is a slide which has been repeated once again. PQR27 tells us about the painless hoarseness in the morning. So this is the normal vocal cord we have, and this is slightly inflamed vocal cord. Chronic laryngitis is more persistent, that produces lingering hoarseness. It is usually painless and has no significant sign of inflammation if you examine, because acid reflux usually is worse when lying down. The hoarseness caused by gastroesophageal reflux disorder often is most noticeable in the mornings, especially right after awakening. PQR28 tells us about desire to be magnetized, and Calcarea Carb have a tendency to tired easily, to move slowly and sluggishly, and have a poor muscle tone. Females suffer from menorrhagia. Intellectually, they are marked by the same slowness and lack of energy that characterizes their physical movements. This desire to be magnetized points to the treatment from the animal magnetism, as it is suggested in aphorism 293, where it tells us it is serviceable in uterine hemorrhages even in the last stages when death seems approaching, or it is useful by distributing the vital force uniformly throughout the organism by means of a single but somewhat stronger pass. So this is the story of past. However, it is a historical thing for our literature which we can reproduce here. So friends, thank you very much for your patient listening. Thanks once again.